United Lutheran Seminary presents the Seminary Explores podcast, conversations on faith, art, people, politics, theology, life, and more, with voices from around the corner and around the globe.
Solving the world's health problems one disease at a time. We're talking particularly about the disease of the guinea worm, which is a disease that ravages Central Africa. And we're talking to Kate Braband. She is the Senior Associate Director of the Carter Center, Program Development at the Carter Center from Atlanta, Georgia, where she lives. And we're talking to her today from Gettysburg, where we live. Kate, what is guinea worm, and why is it such a problem worldwide? We don't hear much about it in the United States.
Sure. You probably haven't heard a lot about it because it's considered a neglected tropical disease. Those are called NTDs for short. In the 1980s, President Carter and health leaders from the United States and globally took an interest in this disease, recognizing that it was affecting poor communities in the poorest countries in the world. At that time, it was in 21 countries, and we saw about 3.5 cases of guinea worm disease annually. It's a waterborne parasitic disease. So what happens, Jerry, is when you drink water that has any copepods or small water fleas that might harbor this parasite, if you drink water that's unfiltered, you ingest that copepod and you give it a breeding ground. And over the course of maybe 10 to 14 months, a worm develops inside your body. They tend to be about 1 meter long, so it's 3 feet or so. And then they'll start emerging from any place they can come out. They often come out of your foot, but it feels extremely painful and a burning sensation. It's sometimes been called the fiery serpent, and folks think that it existed back in biblical times. So it's an incapacitating disease that would prevent people from working in their fields if they're a farmer, from going to school if they're a child, and we're trying to wipe it off the face of the earth so that it no longer plagues people in this world.
This is an internal worm.
Yeah.
I don't want me to be gross, but suddenly it strikes me that starting from a small parasite, it can grow into 3 feet long inside the human being before it's got to break out, and then it does. And what do they do to get it out then if it starts to appear on the surface? Do they tend to try to pull it out? Or?
Right. The way it's by design that it comes out feeling fiery, so people's first instinct is to submerge that limb in the water so that they can feel relief, and that gives the parasite a way to continue its cycle of transmission by releasing more of the parasites into the water, so that anyone that drinks that infected water would then also become infected. The way that when a case is detected, and we call it contained, there are centers where folks can go to be treated for guinea worm disease, and so at those centers, the limb would be submerged in a bucket or some controlled source of water, and then forcing the worm to think that it's in another source of water, and that they'll be twisted out slowly with a small stick, and wrapping the worm around it, because you don't want the worm to break off. If that happens, you can cause infection in the person that's living with the worm.
Once it appears, it's best to try to pull. Oh my gosh.
Yeah, but it takes time. You need to let it emerge on its own. There's no yanking involved. I haven't had the distinct pleasure of seeing a guinea worm removed, and I'm afraid I might faint if I did. But it's a slow process.
We call this a neglected tropical disease. What tropical countries? So we're talking primarily about Africa.
Yeah, it's
Central Africa.
It's left primarily in Africa. We have cases this year in South Sudan. And in, now I'm blanking. There are no human cases that I'm aware of yet in Mali or Ethiopia. We have seen cases in South Sudan, in Ethiopia, and in Chad. So we're down to 5 countries.
And let's go back then to say there's the record here is by and large a record of success.
Yes.
It's been eradicated in many places already.
Yeah, there's been tremendous progress. Like I said, it was in 21 countries to begin with. So we're now down to 5. The process for proving eradication is a time-intensive one. So once a country has no more cases, they have to go for 3 years with continued surveillance, and then they have to prove to an international certifying body that's made up from experts around the world that there haven't been any cases, or that if there had been cases, they would have been detected. After that 3-year period, another body considers certifying a country as having eradicated the disease. So the 15 or 16 countries that have certified at this point have all gone through that process, and that's what we're moving these 5 remaining countries towards, that certification.
Was the answer pouring in a lot of medicine to these countries and throwing around a lot of money and lining people up at clinics?
No, there's not.
Giving them a shot?
There's no drug to treat or cure guinea worm, and there's no vaccine to prevent it. So it's particularly challenging and provides a fascinating model for eradication. You may know that smallpox was eradicated. That was a vaccine preventable disease, and so that demanded a different set of interventions. With guinea worm, we're really looking at behavior change interventions, so helping communities to know that they need to filter their drinking water, that they shouldn't put anything that seems like it might be a guinea worm. It's characterized by a blister when the worm starts coming out, helping communities know not to put that foot or arm
go down to the stream.
Into the stream, that you need to seek care. And that also serves as what we call kind of redundant surveillance. In public health, we talk about surveillance as the way of, what system is keeping track of what diseases are popping up and where, so that you can reduce the incidence of a disease. And so with guinea worm, and having communities aware and reporting cases that they see, there's actually a reward, anywhere from $100 to $500 in each country, which is a significant amount of money for reporting a case that is confirmed as guinea worm. So there's an incentive to communities to report. There are cases of communities reporting fake guinea worms, but they're all lab tested. They come to the U.S., to the Centers for Disease Control and Prevention in Atlanta, and are tested to confirm whether they are or are not guinea worms. But the thinking is that once you issue those rewards to the people who've reported them, there is an incentive to report and to reduce, therefore, the spread of the disease.
Do you and the center send hundreds of Americans over there to open up clinics, or do you work from the villages on up?
Yeah, we're working through the Ministries of Health. So the guinea worm eradication program is a global effort that the Carter Center, in partnership with national ministries of health of those affected countries, along with the World Health Organization and other strategic partners, are implementing together. So in Mali, for example, it's the Ministry of Health that is running that program. They have oversight. The Carter Center is providing technical assistance. Given that we've fought this disease in other countries, we can also provide cross-pollination with other countries if there are experts that may be helpful. But it's ultimately a program that belongs to their Ministry of Health, and there are village volunteers that work at a village level to conduct the community education about not putting your limb into the water, not drinking infected water. Those village volunteers also help with the surveillance that I spoke about earlier by doing case searches in the villages that are of highest priority, where we've seen the most cases. And when I say most cases, I think our count this year is in the mid-20s so far. We released the annual case count, so the 2018 numbers will come by mid-January. But in 2017, there were 30 cases for the whole year. But those villages that have the most cases are having daily case searches by village volunteers, where they're checking in with all of their neighbors and whoever is in what's considered their catchment area, or the area they're responsible for. They're checking daily to see that no one has had any signs or symptoms of guinea worm.
The infrastructure of these villages is a challenge. Some don't. I'm just guessing. Some don't have wells. They're very dependent on a source of water like a lake or a stream. And when they do have wells, they could be polluted. Does there have to be some coordination of effort to get? When you say filtering, I'm leading up to how is the water filtered? Filtered out of a well, out of a stream, out of a lake, or on all three?
Sure.
Or more.
Yeah, typically when there's a well or a borehole, that's considered a safe source of drinking water, and we see fewer cases or lesser spread. But you're right that many villages are drinking from a stream or a lake or other lagoons. Vestagard is one of the corporate partners that has supported the eradication program for a number of years, and they've developed pipe filters that can actually. So there are two different primary ways of filtering. If you're maybe in a more sedentary or village-based setting where people have a home that they come back to and are not nomadic, you could have a cloth filter that maybe is used for the totality of your family or household's drinking water source that you can filter a large portion at once. If you're people who are on the move more, nomadic, or caring for cattle or other things, there are pipe filters, which Vestagard makes, that they're essentially on a lanyard around folks' necks that you can just simply drink through. So it's like a straw, which I understand was developed into a commercial product, Life Straw, that my nephew actually got for Christmas for his upcoming trip to Tanzania. It's been commercialized, a more robust version, but this pipe filter, which is donated to the program, is distributed in communities that would be more nomadic, and so that folks can have they can make a source of water safe by drinking through that and preventing guinea worm that way.
Solving the world's health crises one disease at a time is our topic today. I'm Jerry Christensen for the Seminary Explorers, welcoming to our microphones Ms. Kate Braband, a Senior Associate Director of Program Development at the Carter Center in Atlanta, Georgia. You've had tremendous success with this so far. And there are some challenges yet to go, but we're only talking about one disease. Let's drop back before we talk about other diseases. What is the Carter Center, and who is Carter? What is the Carter Center? What are its missions?
Sure. Well, the Carter Center was founded by former U.S. President Jimmy Carter and his wife Rosalind Carter in the mid-1980s. After his presidency was finished, they came back to Georgia, where they're originally from, established their presidential library and museum, which all former presidents have, in a location of their choosing. And at that same time, they established the Carter Center, which is a nonprofit that works primarily on peace and health programs in the world. Our mission is really one of building hope, waging peace, and fighting disease. So in addition to the health programs that are primarily focused around neglected tropical diseases, as well as mental health, which we can consider in a lot of contexts its own type of neglected disease in the world, something that's not talked about, that there's a lot of stigma around. In addition to those health programs, there are also peace programs that can be observing elections to ensure fair and free elections. There are a number of conflict resolution efforts, as well as human rights programs. President Carter has been a long-term defender of human rights and believer in them. A lot of the health work also stems from his belief of health as a human right. So those are the primary areas that the center is working in. We're about 200 or so staff in Atlanta, and then probably thousands across the world. I think our current count is working in, I want to say 80 countries. It ebbs and flows depending where we're observing elections or other things. With the health programs in particular, there's maybe a longer standing commitment. Many of the peace programs work for a number of years in one country, but with guinea worm, for example, you have, relationships of 10 to 15 years in a particular country where we've been working with the Ministry of Health. In many cases, not just on guinea worm, but some of the other diseases, neglected tropical diseases that we're working on, river blindness, malaria.
Oh, yeah.
Yeah, trachoma. So trachoma and river blindness in particular are blinding diseases, and so working to prevent preventable blindness from neglected tropical diseases in those cases.
In doing this, you've already referred to different organizations. You work in cooperation with, say, the World Health Organization of the United Nations?
Correct.
And, of course, with local governments, and you're working with some international corporations to develop kind of systems or even tools for the prevention or for the eradication of disease before it starts.
Yes.
Filters, clean water, and so
Correct.
on. So it's not just a standalone organization. The other thing that impresses me is that the Carter Center set out with specific goals. They don't just say, we're going to talk about peace. Let's together have a little chat. We're going to solve the World Health Organization. Give us your money. We have focused attempts, keeping records, measuring success and failure, and so on. We would call that a rational approach, wouldn't we? I mean, an organized approach.
Certainly, yeah. We are data-driven. These health programs collect Lots and lots of data to show how progress is being made to help us with course correction when things aren't going in the right direction. And you rightly raise, successes and failures. And something that I think is interesting and likely unique with the Carter Center is that one of our principles is that we accept failure as an option. We're also looking to not duplicate the effective efforts of others. So the areas that we're working in, at this point, people joke that neglected tropical diseases are no longer neglected because there has been a groundswell of support to global health broadly and to neglected tropical diseases. But as I mentioned earlier, when Carter Center began working on these 30 years ago, no one was paying attention to them. And so we really pride ourselves on working on issue areas or diseases that not many others can or want to focus on.
And that's probably kind of the approach of the Carter Center.
Yeah.
Let's see what's out there, and then you develop statistics and case studies, a narrative on what is really needed and where, and then go to work on it. Rather again just saying, well, let's disregard that because we don't know anything about it.
Certainly,
it's not a popular disease.
Yeah, and I think another strength to the approach is the government buy-in. We're only in countries where we've been invited by a government to be there. So whether it's election observation or the health programs, we require and wait on an invitation from a government. We could advocate for that invitation, but without an invitation, we're not barging in to say this is what you need to be doing.
That's kind of a nice segue into saying it does help to have somebody at the top of the corporation who has already had contact with nearly all, at one time, with all the heads of states and knows his way around. And when he sends in his calling card, it's not Jerry or Kate, but it's former President Carter.
Yeah.
Tell us about the two of them.
Yeah.
We saw them at Mr. and President and Mrs. Carter. We saw them at the funeral of George H.W. Bush, and though they are how old now? They look like they're in very good health.
They're in their early 90s and doing, if I could bottle their energy and use some of it, I would be glad to. They're very inspiring and engaged founders of the center and continue to remain very active. They're there probably every other month, sometimes every month for events or engagements. They are, really inspiring to the staff who work there and to the people who work on programs there, and they channel that. I mean, they welcome, there's 3 sets of interns that come through the Carter Center in any given year in different semesters, and the Carters welcome those interns to Plains one weekend, 3 times a year, 3 different weekends in a year for the different terms, and greet them. And they're shown, the interns get to know Plains a little bit and meet with the Carters in a group, which is incredibly inspiring, to young people and to those of us older folks alike who have, seen the work that they've done during the presidency and after.
There's a bit of a hands-on approach then still, and also review of directions so that whatever their original vision was, the two of them, they can see that it's still being carried out, and maybe a little bit of work with the L2 on successes and failures.
Sorry.
They're hands-on enough so that when they do come to Atlanta, they're there to help review directions, mission, even some bits on successes and failures, so that as long as they are alive, there will be a renewed focus on where the center is going.
Yeah, they are actively involved. In recent years they've stepped back a bit from that, but they were previously, they were briefed regularly on the status of programs, and at their request, we will provide briefings on the status of any and all of the programs. And as they do a tremendous amount of work also with Habitat for Humanity, also with their community in Plains, where they spend most of the year. So they, it must be hard to step away from your life's work that way. And they keep talking about, quote, retiring. But their grandson, Jason Carter, is the chair of the board now. And there's, there remains a strong commitment to these health and peace programs. We're in the process of doing a strategic planning exercise now, so we'll see where that leads us. But I think these commitments to areas that others aren't focusing on is likely to remain.
We've shifted all the way from a world health issue to a particular person or two, but they're related. I know he's been known for years, Jimmy Carter, for a Sunday school class he offers in Plains,
Yes,
and we've sent seminary groups down there. You go to the class, you also have to then go to the church. You just can't drop in to say, oh, yeah, we saw the president. So there's the Sunday school thing, plus the Habitat for Humanity, plus the Carter Center. And so in a way, it's probably important that he's beginning to step away so that these various activities will carry on, which is an important facet of our lives. Moving on and seeing that other people pick it up. Yeah. What is your particular job these days? Are you in program development, finance development, both, and them plus others? Sure. You visit Africa a lot.
Before I go to that, if I may, there's a few other things President Carter spends his time on, and I can't name them all, but he has a gift for painting. He's an accomplished painter. He's also a woodworker.
Yes.
So there's a lot
all
of
the furniture in his house.
So many talents that he has, which are really impressive. And you're right. I think there comes a time when you like to step away, but he's also he's published a number of books. I should know how many, but at least 20, if not more. And is, I think, one of 2 presidents that's received 2 Grammys for spoken word of reading those books. So in terms of my work, which is much less interesting and broad than President Carter's, the programs development team that I work on is responsible for cultivating and stewarding relationships with institutional donors. So that's primarily foundations, governments, corporations who support the Carter Center's work overseas. In my particular instance, and in most of my colleagues who do similar work, it winds up being a fair amount of writing of proposals, meeting with prospective donors or with current donors to apprise them of how the program stands, writing reports and providing updates. So there's whenever we have a delegation or a particular donor from one of those groups, the corporations or otherwise, that wish to meet with staff at the center, or sometimes even President Carter, we're responsible for kind of arranging those rather robust visits and sets of meetings. So I've had a few of those on my plate this fall, but that's really exciting and a lot of what drew me to the Carter Center, because I think it's a unique nonprofit. Not many nonprofits have the benefit of having a former president at their helm and the access that you mentioned that affords. And so there's a lot of exciting work and meetings that I've had a chance to be a part of that I got to plan or participate in that I would never have at another nonprofit. So that's really rewarding.
You haven't started to call him Jimmy.
No.
You have met him. He calls you Kate, I'm sure, but one doesn't do that with a former president.
Yes, no, it's most... yes, sir, or President Carter. And usually when you're told, wise advice, don't speak unless spoken to. So when you're in the development team that's responsible for bringing funds into the center, you got a little more visibility, perhaps. Right. But the staff who's running the programs are really the ones, without them, there would be no center. And same for the staff who are in the countries that we're working in. They're the ones who are really the boots on the ground and making the work happen. We're just in charge of representing that and conveying it and matching that with people who would like to support that type of work.
We've been talking about how we can improve world health by addressing one disease at a time, with the example of the Carter Center in Central Africa, particularly with the guinea worm disease. And our guest, Kate Braband, Senior Associate Director of Program Development at the Carter Center in Atlanta, Georgia. For the Seminary Explorers, I'm Jerry Christensen. Have a very good day.
You have been listening to The Seminary Explorers, a production of United Lutheran Seminary with campuses in Gettysburg, Pennsylvania and Philadelphia, Pennsylvania. We invite you to visit our website at unitedlutheranseminary.edu. Opinions expressed on this program are not necessarily those of United Lutheran Seminary or the Evangelical Lutheran Church in America.